not been there, you would not have had any problem. You would have been able to access the market for developing the land and allocating for health or anything else. That is the crux of the situation. We had, I think only now that monopolistic status is a little relaxed, but DDA had a monopoly over land. So they would allocate, majority of that they would allocate to the government. Government was not in a position to develop. So, right, lying idle. Whereas, I mean, the land for the hospitals is required by the private sector. And I mean, just little clarifications where and yes, as a driver of the health policy, I mean, I am a student of health policy, I mean, public policy really. It's the job of the government. It is the responsibility of the government to drive the health policy or any policy whatsoever. I mean, you are policy takers. You are policy takers. The policy driver is the state, whosoever that is. Thank you.
Just a point to be added there. Whatever be the allocation and the mode of allocation of the land, my point which I was trying to make was that land should be made available at a very subsidized or perhaps a magical 1 rupee per square foot or whatever figure it may be. The implementation of why that has been done has to be stringent. And if there are hospitals which are blatantly defying this for the last 15 years, I think the government has compounded its mistake by keeping quiet.
In fact, my argument, even in government meetings, is in the favor that, okay, you gave land so subsidized or whatever, at least that created infrastructure in the city. At least the services are available to those who can afford. And that's not happening in Ghaziabad. That's not happening other places.
If land as a medical town cities are identified by the government and the infrastructure is built, good amount of young talent, if they are given facilities, schooling for the children, basic amenities, and a good place to work, professional environment, a lot of people will think of that. I'm not saying at the present moment they will go, but the idea and a move towards that will happen.
Another thing, sir, sorry, I forgot another issue. It was presence of government and private sector in primary, secondary and tertiary healthcare. Okay, to me, in primary healthcare, private presence is the most. All those clinicians like me, one-man clinicians or whatever, they are in the private, I mean, primary sector only. It is the preventive healthcare where the cost cannot be recovered. There is no alternative but the government, but the state. You do not expect private player to invest if he cannot recover. It's a free good, free access.
See, there are two fundamental issues. That private sector comprises of both corporate sector, which is for profit, and not for profit, the voluntary sector. Now, having been, I remember we signed the deal with Delhi government when they allotted 4 acres of land to me for 40,000 rupees. This is the Batra hospital. I'm talking of 1982. So we got 4 acres of land for 40,000 rupees, but with some obligation. And till today, Dr. Bagai will bear with me that yes, those obligations are still being met. And Dr. Singla, you know very well that Batra is complying. I think one of the institutions which is complying fully.
Yeah.
The second very important aspect is that the state governments realizing that they have to incentivize investment in healthcare because the price is a function of cost. The corporate sector can reduce the price of their services dramatically if their cost of construction, and which includes the cost of land, is reduced. So government is actually helping them subsidize their fee structure. Now, there are at least 2 more examples. We have already identified in Jammu and Kashmir that in order to attract corporate sector, we need to pass a legislation, and that we are going through in March this year. Another example where legislation was not required was Raipur. I'm chairman of an advisory council for Vedanta, which is building a 350-bedded cancer hospital. Now, we argued with the Chief Minister for 2 hours, and he allotted 50 acres of land for 1 rupee with no obligations. So there are the government public policy, and by virtue of the necessity, must look at this cost because it goes as a revenue to the state. What will they do as revenue? I've said more than what I wanted to, but there are many examples where land is being given to healthcare sector at a very, very highly subsidized or at no cost basis.
We'll take Mr. Mahajan's question because he's been standing for, and that will be the last question. After that, please interact during lunch if you have questions. Yeah, go ahead.
Actually, I have a different take on whatever we are discussing. This is the Healthcare Leaders Forum. We're talking about government, private sector, this thing and shortages, etc. Well taken. China in 10 years' time, from practically nowhere, became a leader in manufacturing. Today, even as we stand in this room, within 5, maybe 10 years' time, India has a potential, I say potential, to become the leading healthcare provider. Let me give you 2 or 3 points so that you don't totally say this guy's gone bonkers. One point is manpower, which is the most crucial thing if you ask me. Every year, 3 lakh people sit for the medical entrance exam, and about 30 or whatever thousand odd people make it. I am 100% sure even if 2 lakh could make it, they would not make maybe the best doctors, but they'd definitely make serviceable doctors. So we have a capacity of increasing our medical raw material, if I can call it, 10 times. So that's something we can do in 5 years' time. Next, talk about the next thing, hospitals. I am from IT field. I'm a management consultant. I have only one observation to say. We make each hospital as if it's a product of love. An aircraft carrier, if some of you remember the olden days, used to take about 13 years to make. It was again a product of love. Came Second World War, and America after Pearl Harbor didn't have a choice. They had to make aircraft carriers like yesterday. They brought the 13 years lead time for making an aircraft carrier to 9 months. As a manufacturing man, how did they do it? Let me share it with you. And then I like to extrapolate how it's going to impact the healthcare thing. Just like you make cars, they put the whole thing on an assembly line. Standard modular blocks, you assemble them. Don't design everything. Make 3 or 4 standard modular designs, say for planes, for a 50 bed, for a 100 bed, so and so. That means you do not have an infinite variety. Now when you standardize it, you do 2 more things. Whenever a hospital gets started, the processes, the architect said, men make houses and then the houses make men. Because depending on your layouts and other things, your processes in the hospitals, etc., and facilities will change with the layout. Now if you have a couple of standard designs, which obviously can be decided in also for different locales, for different specialities, etc., and we don't have an infinite variety, then we can have standardized processes which we teach to all our med school students and make it a part of their med school hospitals. So when they come out of the assembly line, if I can call it, of the medical school education system, they are immediately productive. And they can transfer from one hospital to another hospital without being, it's not that Apollo follows some system, this thing. And a corollary to that is all these processes, if they are reasonably standardized and they are backed up by a good EMR like what Dr. Ahmed is doing, and it's a very bold step I can assure you. I've been in Vista for about 5 years, and I can say one thing, it is an affordable healthcare system. It is very comprehensive, it's very complicated, but it's the only system which I think will be able to create and support a national healthcare information sharing system, which is what the US right now, they've got about 300 EMR systems, and they're going crazy trying to make a regional or a healthcare system. And then all the things which you talked about, you know, portability of healthcare records, all that thing. And if you have a good healthcare system, it can straight away buttress your public healthcare, it can straight away buttress your, cut down your re-examination, all those costs, etc. I just wanted to share this. Thank you.
Hello.
I had one of the topics in my mind to address very briefly was the education and the doctors and system, but I think it's a topic which will actually have a 3-day seminar and still will be groping for answers. I think whichever human being you put in whichever assembly line, you will not be able to get a doctor. I think building doctors is a very unique phenomena. It takes 6 years to get a primary MBBS doctor. It takes another 3 years to do your MD and MS, and it takes another 3 years to finish your MCH or DM. That is, if the system works properly and you get your seats without reservations and without everything else. So it takes a good 12 years before a specialist starts training in private. I'm using the word starts training in private. So even if we start now, it's 12 years down the line that we'll have specialists on the field. Being gone through the full gamut of up and down 15 years and beyond, I think an MBBS doctor is still going to be learning medicine for a very long time. I'm completely in disagreement, and I cannot have been in more disagreement than having a 3-year rural healthcare scheme. We're going to be producing half-baked pancakes. You cannot have this sort of system. You cannot have short answers for a very major problem. I think the grassroots problem needs to be addressed. The healthcare system in India needs to be addressed, which Medical Council of India is doing, or rather is trying to doing, but then the government is interfering. So I think MCI per se should be made autonomous. The rules, regulations should be separate. Doctors should be allowed to practice with freedom.
I think that this debate can continue for another 4 days, if you like. So I actually want to thank our panelists for taking the time out and for the audience for being actively engaged. And please engage with them during lunch if you can. Thank you all. Thank you.